So training your staff, and we've seen this is a very important aspect of your plan. It's important to not only have the plan and making sure that's up to date, but if your staff doesn't know anything about your plan or understand the specifics of what you do, then it's almost as if you don't have a plan. There was a really interesting report that came out in 2016 from Experian, and they dubbed 2015 to be the year of the healthcare hack. And the reason is that healthcare information they've determined is more important and more valuable to a hacker than any other information. Credit card information, you know, that's good for maybe $100. You can shut down a credit card really fast. There are rules in place that say, hey, you know, I'm not responsible for that information. But the problem comes is, how do you turn off your health information? That includes, you know, social security numbers lots of times. That has, you know, where you're located, and it just has a wealth of information that somebody can use not only to mimic you and go out and get health care for themselves, or we've seen people using it to apply for microloans or for, you know, also using it for its tax time, using it to file IRS returns and to get that money back. So we've seen lots of that. And it's really important because you need to impart upon your staff how important this is, and that really a lot of these breaches come from problems that staff members create. And it's not malicious. They just, it's almost like a complacency. So you really need to educate them about how valuable this information is, not only financially to hackers and to other people outside of your practice, but how important that is to also keeping your practice going. I've said this before. You guys are in the realm of trust. I think that's one of your biggest items that you have, is that your patients return to you because they trust you. And if you have a hack and you have that conversation with, hey, I'm really sorry, we had this hack, this is what we're doing, you know, that's a very expensive prospect for a practice, not only to try to remedy that breach, but then also the attrition that you would have. I saw a report that said that somewhere around 50% of people under the age of 40 would leave a provider if they were notified of a breach. So, I mean, that's a pretty significant amount of people that would cease to use your services, and that's hard to recover from. So, what is required? So you're required to train your staff not only on the law. Now, when I talk about staff, I want to also let you know how important it is for IT staff, front desk staff. Any volunteers are important. They have to be trained because they come in contact with PHI. That's important to remember. And they also need to know about your policies and procedures. So if they need to know, generally, they need to understand what the law is, and they have to understand. So that's two parts to that.